Start with something that is small, that you can move quickly on, that you can change course and adjust, but that is directly impactful to that end user.
Welcome to Unlocking Big Data, a series about getting trusted data to healthcare decision makers, presented by HIMSS. In December 2023, HIMSS Market Insights conducted research with 100 healthcare leaders to understand perspectives on the use of data analytics platforms. Throughout the series, we'll present key data points from the research and focus on why these data points are important and how you can leverage them to support your healthcare organization's data initiatives. Today, I'm joined by Julius Bogdan, Vice President and General Manager, Digital Health Advisory, North America, HIMSS, and Mary Kuchenbrod, Vice President of Data Operations at Arcadia. So welcome, Mary and Julius. According to the research, more than 4 in 5 healthcare leaders estimate that over half their organization's data is accurate and reliable. But it's only just over half who say that the majority of this data are being used to make intelligent business decisions. So clearly there's a lot more work to be done to improve accuracy and reliability. And I'd love to start with you, Julius, in terms of seeing what you're seeing out there in terms of best practices to do this.
This is a really relevant topic these days. There's not a week that doesn't go by where healthcare leaders reach out and ask, hey, am I ready for AI? Am I ready for, kind of what's next in the analytics space? The challenge is, healthcare leaders tell me that they're swimming in data, that they've got more data than they know what to do with. They're not getting to the insights, and there's one of the biggest hurdles to do that is because of the data quality issues that we have. With the advent of the EMR, we got flooded with data about our patients and our populations, and then you layer on all of these other systems that we have, our ERPs and HR and, supply chain systems and everything else, and you have this challenge of data standardization and data quality that kind of is pervasive in healthcare and most industries as well. And so one of the biggest things that really healthcare organizations can do is to have a data governance strategy. And so starting with a strategy around how you're going to govern these data assets that you've got, starting with standardization of terms, definitions, inputs, right? So optimizing your workflows, minimizing the free text and other things that come in that can be really hard to quantify on the back end is part of the whole data governance strategy that needs to be employed. And data governance is a broad business initiative. It's not an IT initiative. It's a business initiative that you have to have buy-in at all levels of the organization in order to start achieving that. Once you do that, then you layer in data quality and master data management to identify sources of truth and define that, and then, like any other asset that you have, you manage it. So that's kind of what we're seeing, as one of the biggest challenges in healthcare today.
I like the idea of that sort of staged approach as well. And Mary, you work across the spectrum with your clients as they sort of adopt these technologies. So what are you seeing in terms of strategies to improve data reliability?
You really need a lot of different kinds of strategies to have a comprehensive data governance approach. They use this term in the military and in cybersecurity, left of boom versus right of boom. It's like something going wrong. What do you do before something goes wrong to be prepared and proactive? And then what do you do after something has already happened? And with healthcare data, because it's so messy, so challenging, there's so much of it, you have to admit that no matter how much preparation you've put into place, no matter what you're doing to ensure that you're automating tasks that people could have human error in if they were doing manually, following checklists, entry checks on new data coming in, no matter what you do to prevent things from happening, eventually something will. It's healthcare data and it's messy. So what are your right of boom strategies? How do you flag that something anomalous just happened in the system and contain that from impacting the downstream consumers who are going to be using this data to make decisions? How do you have a system that allows for a very, very rapid recovery from that moment of recognizing, hey, something doesn't look right about this data that's impacting my ability to use it? How do I minimize that impact? How do I keep the end users of the data as safe as possible from those downstream ramifications?
That's really interesting to think that it's going to be inevitable that you're going to have one of these sort of challenging crises happen in this new era. So, Julius, from your standpoint then, you mentioned the importance of kind of gaining consensus on these sort of complex clinical terms, even just the definitional level. So what happens then when we have to adapt, to these scenarios? You spend all this time, zeroing in on.
In a previous life, I was a chief data officer for a healthcare system, and one of the first things that happened was our chief medical officer came and said, hey, I'm trying to do a analysis of our total joint replacement program, and I've got 4 different reports from 4 different sources telling me 4 different things. Which one's right? Well, the challenge with that is they're all right, but they have different definitions, different metrics, and so getting a handle on the definitions and the metrics that you're going to utilize is the first step. When you have all of this data from these disparate sources, understanding the heuristics of that data will really help you understand what the characteristics of that data are, informing you, for future uses such as, things like bias or both implicit and explicit, the characteristics of, what conditions or algorithms that data is suited for, right? So, it's not just the definitions and data capture. It's understanding that data to a deeper level. And most organizations they focus on the data governance and they focus on the data capture part. They don't understand the characteristics of their data to then be able to put in these solutions for AI or others that can be influenced by that data. So, from that perspective, it is an evolutionary process, and the holistic view is, from, data inception or data capture all the way through to the solution that you need to consider that data management and data lifecycle.
So from the vendor perspective, how are you seeing yourself being a good partner to folks at this very sort of exciting juncture in AI and analytics?
Well, I think partner is really the operative word, actually. To work with data, to understand its full lineage and its full life cycle, you need to pair up an analytics partner, an analytics vendor, a data platform, their knowledge of their own system, of what happens at every step along the way, with the healthcare organization's knowledge of their own data. How was that data generated? What workflows were followed in the EHR? What's the contract structure between that provider and that health plan? Those things are critical context to be able to interpret or use or contextualize, if you ask a question of the data, how to interpret the answer that you got back. Whether that's a very simple question, do I have a readmissions problem? Or something very complex, like how am I going to start to use large learning models to add scalability and to add more top-of-license execution throughout my clinical ecosystem?
And a question for you, and that I also want Julius to answer, has to do with sort of trust in the data. Not just trust in the data, but sort of trust in this moment that we're in right now, with AI changing so quickly. So can you speak to your role as a data partner and a vendor in helping to augment that trust?
I think with anything, to build trust, you have to start with something small, with something direct and tangible, to see whether it's getting exposure to a new data source or getting exposure to the results of a new chatbot interaction or something that is summarizing data for a care manager so they're spending less time just combing through charts. Start with something that is small, that you can move quickly on, that you can change course and adjust, but that is directly impactful to that end user. If you start with the whole world, that's overwhelming. There's too much to figure out. There's so many unknowns. So some of the sort of just classic change management really does apply. Get some quick wins. Start with something we can all align on.
And is that in any way at odds with the idea of having to have a comprehensive, sort of well-managed and well-staged strategy?
No, not at all. And I totally agree with that approach. I've implemented it, and that's really the only way that I've seen it being successful. You need a overall arching strategy, for data management, data governance, all of that, analytics, and AI as well. But to Mary's point, you start with small incremental steps, to prove it out. Trust is one of the biggest issues with advanced analytic solutions or AI, and it's because one, the transparency and understanding what the solutions are actually doing, oftentimes can be perceived as a black box, and then the other is trust in the data. So if there's a lack of trust in the data or in the lack of understanding of how the solution's actually coming up with the outcomes or the results, you're going to limit and minimize the adoption of that solution. So, starting off small, tackling, a key, but limited problem that your organization's facing. For example, every organization, healthcare organization, has some sort of lean process or process around analyzing length of stay, right? Building some steps into that lean process or into that, kind of broader problem, but limited to the scope of length of stay, would be a critical win that you can show. Here's how analytics and data can help support this, key analysis that you're doing. Get a win and then move on and build from there. So I totally agree with Mary on that approach.
There's humility that's required working with complex data solutions to admit, especially as the industry is moving it from beyond just more simple machine learning all the way into the large language models and the neural networks, to admit what we don't know, to admit what we're not sure about, but that we're going to figure out as we go along. And the healthcare industry has been through an immense amount of lack of certainty, with the pandemic, with supply chain, with all of the operating cost pressures that organizations are facing now. And so I think there's an honesty in that, in saying, we don't know exactly how this is going to work. Here's what we're trying. Here's what we're aiming for. Let's work together really closely to see if it feels like we're achieving that or if we need to rethink things and start over.
That's wonderful. I love the contextualization of risk in that way, and the idea that there is governance, there is process that can guide us even as we experiment and go for these sort of quick and iterative wins. So thank you both for sharing your insights with me today.
Pleasure to be here.
Absolutely. Thank you.
Be sure to catch the companion HIMSScast podcast with Julius and Mary for more on how to extract the most from your organization's healthcare data. For HIMSS TV, I'm Indu Subaya.